Welcome to today's edition of Mental Health Matters. Today we're going to be talking about living in recovery from mental health. We have Gustavo Ayala on the show today, and he's going to share his personal story. So get some snacks and something to drink and come on back and stay tuned. Gustavo, welcome back to the show. How have you been doing, man?
First of all, Jesse, thanks for having me back on the show. It's definitely an honor. It's a pleasure. I'm a lot more comfortable this time being on the show. I'm not gonna lie, I was a little nervous last time, but I feel like in terms of mental health recovery, I live it every day. So it's part of my life. So I've been doing well. I'm doing well. I'm employed as a wellness mentor. I will give my agency a quick little shout out. I work for Wellness Recovery Center South.
Okay.
So we're doing good things out there. So you guys come see us. You know, after the show, if you're interested in what we provide, come and see us.
Okay. So let's talk a little bit about, just share a little bit about, in depth a little bit about who you are as a person, because I want the people who watch the show to be able to know who you are and if they can even identify with you.
Absolutely. Well, at the age of 30, I was diagnosed. They call them episodes now, but I had pretty much a breakdown. I'm 46 now. I was 30 years old, and I got
Hold on. How old are you?
I'm 46.
This man said he's 46 years old, and he do not look 46 years. You know you don't look 46
Thank
years
you.
old,
I appreciate that. Thank you.
So you're aging very well.
Thank you so much.
Yeah.
I wish I can take back some of the years that I did a lot of harm to my body, but
Yeah.
we're still here now. We got a story to tell. So I got diagnosed at the age of 30, going backwards. It was on my 30th birthday, actually.
Okay.
So 2003, I got admitted into one of the local mental health facilities.
Okay.
I had a breakdown. I was using and I was drinking heavily, right, to kind of self-medicate myself. I didn't know what I was dealing with at the time.
Yeah.
So when I got admitted, I got diagnosed with bipolar disorder.
Okay.
I got diagnosed with borderline personality disorder. I had severe anxiety, severe depression.
Yeah.
So that was kind of daunting to me at the time. I didn't really know what I was dealing with because I was drinking and using at the time.
Yeah.
So it was a little scary for me. So I dealt with that. I get discharged. I was prescribed 3 medications. I get discharged and really with no path, right? So I failed. I definitely failed and relapsed and had episodes over and over again, even though I wasn't admitted to the hospital.
Yeah.
And so here we are 16 years later, and I kind of stumbled into recovery.
Yeah.
And kind of following what they call the recovery model.
Okay.
Now. So that's where I'm at. So, definitely have a story to share, and I'm definitely in recovery. So we'll go into more in depth on what that means to me.
So I want to ask you a question. So when you found out, or when you discovered that you had bipolar and all that stuff, did you have any a support system in place at that time?
At that time, my biggest support was alcohol.
Okay.
So I drank.
Okay.
And that's part of recovery and why a lot of us fail, because culturally, it really wasn't really accepted for me to be feeling certain things that I was feeling. Right.
Right. Exactly.
I just felt lost. It's hard to explain. But it was definitely, I knew there was something wrong with me, right? Yeah. A lot of my thoughts would just go and spin in circles. Just behaviors that weren't, just to me now in hindsight, weren't normal, right?
Yeah.
I would kind of act abruptly and do odd things, but I didn't know who to talk to, who to share that with. So definitely, I feel in that time in my life, I did not have the proper support that I needed to kind of talk to somebody. And you know, growing up in a Hispanic house, it's very machismic, and basically I was always just told, you know, just wipe that frown off your face and go out there and be a man and work and provide for your family.
Yes.
So that's what I did, but I lived like a double life, you know, because I was out there working, providing, but at the same time I had this dark side to me where I would secretly drink and use and dealing with all these, you know, demons, I guess, or whatnot. These just odd thoughts in my mind.
Yeah. You know, and I think that speaks loud for not just the Hispanic culture, but I also know it's true in the African American culture as well. Yeah. We're taught to not really acknowledge our mental health symptoms or mental health diagnoses. It's, you know, because of what we've been through in slavery. We've been conditioned or trained to be able to take a licking and keep on ticking, so to speak. You know. And for me, that's a false expectation, and people end up falling down and not really being able to get up because they're living in this false expectation. But I do know people personally who has a very identical or very similar story to you. You know, someone that who has not been clinically diagnosed, but obviously you can tell that there's mood disorders, alcoholism, and coupled with other type of narcotics and stuff like that. And you know, this individual comes from a very good family structure, and you know, and their culture is also kind of. Now, I shouldn't say, I'm going to say as a whole, the culture may be in a little bit of denial. Absolutely. Because with this particular culture, it's kind of like mental health is kind of like, in my opinion, it's kind of like, ooh, taboo. Yeah. But you cannot deny what's going on in front of you either, you know. And so for me, I'm kind of glad that this exposure is being out there in the open with mental health, because people are being forced, in a sense, to deal with these issues. That's what's going on. It's not a bad thing. It's just a human condition, in my opinion. Yeah, you're so right. And I see that now working in the industry. There's a lot more compassion and dignity across the board, I think, when we're dealing with people that have a mental illness. You see it in the homeless population as well. And you know, in the way it was dealt with me when I would have my episode, or you know, I was acting out in the public, I went to jail. Yeah. And so those were my mental health services at the time, and that was the last show we did, and we talked about that. Yeah. And so I was definitely shunned, because now I'm labeled as a criminal. I was a felon, you know, but here I was dealing with these mental health issues, and it was never being addressed. Yeah. But there's definitely been a change now in the community, on the local level, and you know, nationwide and even worldwide. You know, the stigma is starting to kind of dissipate. You know, we're going in the right direction. Absolutely, there's definitely a lot of work that needs to be done, but you know, shows like this, opportunities for me to be working in the peer field. I think that's working wonders on the local level. You're putting your experience to work. Absolutely. And you're allowing your experience to help somebody else, so to speak. So what actually led you to want to live in recovery, or what actually led that ball to kind of you start to kind of make steps to recovery? You know, my wife gave me an ultimatum. Okay, so I was came into the relationship with a lot of issues, a lot of baggage. Okay. And I kind of hid them from her. Okay. So basically, she had enough, and so she gave me an ultimatum and said, "You either address your issues," which was drinking at the time. Yeah. She didn't really know the depth of my illness, right? Yeah. So I stopped drinking, pretty much cold turkey. Wow. Right? So and don't suggest that for anyone. You know, it's dangerous. But I quit cold turkey, became very ill. So that was the first step for me. I was just going to stop drinking. So you became ill. Is it due to the withdrawals? To the withdrawals, okay. Yeah. So like I said, I don't suggest anyone to do that without some kind of medical attention or under supervision. So anyways, that led me to, so that was the first step I took. Yeah. I stopped drinking, and just with time, I just try to get healthy, just try to get overall physically healthy by eating better. Right. Right. Trying to get my health in order. Right. And that just kind of led me to a different path, which is the recovery model, which is being used by SAMHSA. SAMHSA uses the recovery model, but I didn't know I was utilizing that at the time. Wow. Right? Until I started bumping around the internet, and I was like, okay, well, I feel better now. My home's, you know, I think the 4 principles of,
of recovery is health, home, purpose, and then your community, right? And so when I started feeling like, okay, I'm starting to feel a purpose now. Like, what am I going to do with my life now?
Yeah.
Because at the time I was a care provider for 2 family members that had passed away.
Okay.
So there's an opportunity for me now to kind of do what I want to do. And so that's how I kind of discovered the path to being a peer partner or peer specialist or a wellness mentor, or whatever you want to label it as.
Yeah.
So that's when I really started to discover what the recovery model is.
Yeah.
And that's when I really started putting those facets to work for me in my life. And I didn't know I had already kind of stepped in that realm without even knowing it.
Yeah, wow. Now, did your wife have any prior mental health experience, any professional experience with working in the field or anything, or?
No, other than
wow.
just dealing with family members. I think we all have a little bit of craziness in our family.
No.
But other than that, no. So she was overwhelmed. She didn't know. She didn't know what she was dealing with, right?
Right at the time, yeah.
But she'd always told me she was my biggest support system at that time.
Yeah.
Because she always told me there's something in there that's good. There's something that needs to come out.
That's awesome.
So she told me, I'm gonna stand by your side.
Yeah.
I'm gonna pretty much ride this out with you.
Yeah.
But you need to figure some things out.
Yeah.
And so that's where we're at now. So definitely a support system there. But prior to that, she had no experience with dealing with these type of issues.
Yeah. So after you had made the commitment of, getting help and trying to walk in the right path, so to speak, did she, at any point in time, did you feel like did she volunteer to go and educate herself on these issues that you was potentially trying to get help with?
Absolutely, because it's kind of, I kind of fell into my own recovery about the same time where it's been about 4 or 5 years now where this whole mental health to stop the stigma steamroll has been it's been getting momentum, right? I think it's more out there, and you got artists out there and people with fame that are starting to come out with their mental illnesses, right? You see the billboards out there, stop stigma. So she's definitely started becoming more aware because she's living with someone that has some issues.
Exactly.
So she did. She went online and she, there's programs out there, there's documentaries, there's movies about people living with mental illness. So it opened her eyes, and she started to get a better understanding of me, where I was coming from. And then when I stopped drinking, I started talking to a therapist and I started discovering what the root of my problem was.
Yeah, wow.
And so we obviously would talk about that in home.
Yeah.
And the drinking wasn't my problem. Using substances wasn't my problem. There was other issues there. And so I kind of had to scrape the surface and peel back the onion, so to speak.
Yeah.
To kind of learn what those issues were.
Yeah.
And so it's been enlightening for the both of us because I think we both opened up, removed some barriers, I think, for our relationship, because she's kind of discovered some things too, also that maybe she's been harboring, and so it's definitely been promotes a healthier environment for us, for our relationship to kind of thrive,
Yeah, the reason why I asked you that question about your wife was because a lot of times people, when they have someone close to them that may be dealing with mental health challenges, sometimes they don't really think that they need to educate themselves. Sometimes they think that, oh, okay, I just need to be here. But education, in my opinion, knowledge is power.
Absolutely.
And so if you're equipped to help somebody, I think you can be more effective. Today I was talking to a friend of mine on the phone before I came to the studio, and her family on her mom's side, and both sides actually, has a generational mental health conditions within their family. And she was telling about her aunt. Her aunt has two boys who actually moved out to another state.
Wow, okay.
Because they didn't know how to deal with her aunt, which is their mother, who have severe mental health challenges. Now this lady is at home by herself, who is no longer bathing, she can't take care of herself. So my friend got a call yesterday, and pretty much her cousin was pretty much trying to tell her, like, look, go over there and get involved, And so I was trying to give her some good advice to kind of pass along to them, and let them know that if you guys don't want to be bothered with her, at least come take some time off work, and you guys come and at least get her some resources, get something for her, but don't just leave her hanging out there dry. And it's sad, man, because even with my friend mom, I was a really good support system to her because I'm in the field. but I was really able to help her to really to know how important it is for her to educate herself on her mom diagnoses, because she didn't really understand. She was responding to her mom in a way as if her mom didn't need help, but she needed help.
Yeah.
And so education, and I'm only saying is if a person is close to somebody that have a mental health challenge, it's important, it's imperative that the person themselves educate themselves so they can be more effective at being a support system.
Yeah, I definitely agree. And that's part of the recovery model too, is a good support system, right?
Yeah.
And you know, the person that's suffering, when they have someone that's close to them, or just even if it's someone as a peer guide or whatnot outside of their home, someone they can talk to and share you know, stories, just how you and I are talking.
Yeah.
That's important. It's imperative because you're like, okay, we have something in common.
Right.
Right. And so it's, you know, they're able to socialize pretty much about what's going on, what ails them. So that's important in staying in recovery, because, you know, you can recover from a mental illness, right? A diagnosis.
Yeah.
But it's still there. It's not. It never goes away.
Yeah.
Right. But you want to try to normalize it as much as possible and associate with people that are familiar with it. Like you said, they're educated about it, that have similar symptoms or similar life experiences, right? So it's important that we kind of talk about these things, right? And especially you get it in a group setting or just one-on-one. That support system can lead to a life lived, right? Instead of being at home, like you said, they're not bathing, they're not socializing, they're not doing anything.
Yeah, isolated.
They're isolated, they're depressed and whatnot. But when you get someone that comes around and can kind of relate, they start feeling like a human being again.
Exactly.
The bottom line is we're all human beings.
That's exactly right.
Right? And so we just want to have that connection just to talk to somebody.
Yeah, and it gives them a sense of purpose to let them know that they're not alone.
Yeah.
You know, this is normal, so to speak. You know?
Yeah, absolutely. I mean, what is normal? Everyone says, oh, I just want to feel normal.
Right.
But honestly, what's the definition of normal? We just want to feel like we're a part of something. You know?
Yeah, exactly. So what do you think the main factor to recovery is?
Hope.
Yeah, okay.
It's hope. Definitely, for me, it's hope, because without any hope, then you just aren't motivated to do anything.
Yes.
I found hope in the jail cell. Okay?
Yeah.
It was probably like my 17th time being incarcerated.
Yeah.
Right? And I'm just like scratching my head like, how did my life become this?
Yeah.
Right? And so I open up the Bible, and I don't want to talk about religion, you know.
This is your story. Whatever you feel that worked for you, I want you to share whatever
and I read some scriptures, and just listening to the words, I just read it as it was just positive feedback for me, right?
Yeah, nice.
And, you know, a lot of people say, oh, yeah, obviously that's just jail talk or whatnot.
Yeah.
But something really reached out to me and really touched me.
Yeah.
And that's where I started beginning my spiritual grounding, and I got a sense of hope.
Yes.
Right? And I just held on to that.
Yeah.
And I still struggled when I was released from jail. I still struggled.
Yeah.
Right? I still continued to drink.
Yeah.
I still didn't deal with my anger issues.
Yeah.
I still didn't deal with the confusion and just the anxiousness and everything, you know. But I always knew that I would go back and hold on to what brought me to this point where there's that hope. And you just hold on. You just got to, it's like a light at the end of the tunnel, right? You got to just walk towards that and gravitate towards that.
Yeah.
And I was taking 2 steps forward, but I was taking 4 steps backwards, right?
Yeah.
But at least I was making steps forward.
Exactly.
And it took time, and it took time, and you know, I climbed out of that hole. It was a dark hole, you know.
Yeah.
And you know, and I still deal with issues.
Yeah.
There's still a lot. It never ends. You still got to put in work.
Yes,
you still got to
exactly.
educate yourself.
Yes.
You still have to stay informed of what's going on out there and the practices being used and utilized, and not be afraid to come on the show to talk to you about it. Honestly,
That's exactly
that helps me.
Yeah.
Right, to put it out there and let people know I used to be like an individual that was isolated at home, didn't want to shower, didn't want to bathe, didn't want to eat.
Yeah.
Now I'm in front of a camera talking about it.
Yeah.
And you tell me that 3 years ago, there's no way.
Yeah.
There's no way. There's no way I would tell myself, looking in the mirror, you're going to be talking to a gentleman about mental health recovery on TV.
Yeah.
There's no way. So that's the hope. Hopefully I can produce that hope for the next person.
Yeah.
To try to get into their own path of living a life that's sustainable and just a livable life. You know?
Yeah. Yeah. Then you just said some powerful, you just gave some powerful information.
Thank you.
You know, without hope, you know, it's kind of like the heart is deferred. Like if you don't have any hope, there's no motivation. If you know, if there's nothing to look forward to, you know, for the most part, you can't be as motivated if you would like to be.
Yeah.
You know, I like to tell people that, you know, when things quote unquote don't seem to be going your way, that does not mean that you're back at square one. That just means that this is part of your recovery process.
It is. And let me tell you what that, you know, that creates when you fall and you fail. It creates resilience.
Exactly.
And resilience is, that's life-changing too.
Yes.
You know, in hindsight, yeah, I failed a lot. Okay?
Yeah.
But it made me stronger each time I'd pick myself up.
Yeah, yeah.
And start utilizing the support that I had.
Yeah.
My wife, the scriptures.
Yes.
Information on YouTube.
Yes.
Reading books.
Yeah.
Listen to positive music. Those are all things that kept me going, right?
Yeah.
And, you know, I won't lie to you, even when I felt I had a good grounding
Yeah.
on my recovery, I had another fall off. I fell off, had an episode, so to speak.
Yeah.
But I didn't dwell on it. I created some harm. You know, I hurt people's feelings.
Yeah.
But I picked myself up again.
Yeah.
And told myself, is this going to be my life again? Or am I going to propel myself and keep on moving forward?
Yes.
And
absolutely.
I did. And that's resilience, right? It's like the phoenix. You know, it's like we burn ourselves down, but
Yeah.
we rise again. And so you have to, you know, I just think that's our human nature.
Yeah. Yeah.
There's more to this life than just living in that darkness. You know?
That's exactly right. You know, I used to be one of those people that, because of my culture, being a black man, and just growing up the way that I did and things like that, I had a very hard shell. I've always been like very hard on myself because of my background. I come from a line of drug addicts, alcoholics. You know, lived in a single parent home, a lot of physical and mental abuse. So just you know, and you know, graduated from high school, nobody's there. People at home drinking. Graduated from grade school, nobody's there. So these things affected me mentally throughout the years, but I didn't know that.
Yeah.
So all the relationships that I got with girls, or if I joined a fraternity and things like that, I didn't know how to have a healthy relationship with these guys that was quote unquote my bros, and the girls I didn't know how, because there was something that was still affected me from my past. And so I create this false reality for myself that I have to be this strong individual because I'm a black man, society's against me.
Yeah.
I come from this, I come from that, and I was determined not to be like the people from my past. But I ended up falling into some of those same patterns, you know what I'm saying, because I deceived myself. And so what happened was, as I started to mature, and as I got to growing in this field of different things, I have allowed myself to be human. In other words, if I make mistakes, you know, if this story doesn't turn out the way that I think it should be, I'm okay.
Yeah.
You know, I'm one that, and this, as paid as this may seem, I hate to waste food. Like, and I'm not, I just, for some reason, it just always bothered me because of the way I grew up, you know. And I like, if I cook some or if I buy something from the restaurant, if I don't eat it all, within my mind, I'm like, okay, I'm gonna have to say this, but don't throw it away.
Yeah.
So there's times where I wasn't hungry and I would have to throw the food away. And guys, I kid you not, it would actually bother me.
Yeah.
So I had to be able to train myself that, okay, it's okay if you throw it away. It's your money, you know, and this is not affecting nobody else.
Yeah.
So, but I've allowed myself to fail, allow myself to be human, so to speak.
And I can totally relate to that because I felt like because of my culture as well, I was always told you got to be working, you got to be busy, you got to do something, you got to stay out of trouble. So when I would have downtime as an adult, right?
Yeah.
I get really anxious because I felt like I have to be doing something.
Yes.
I felt guilty for relaxing.
Yeah.
Because, you know, I don't know what it was. It just, and it really, really bothered me.
Yeah.
It really bothered me. Like I always felt there's a need to be doing something.
Yeah.
Even if it was just walking around in circles, you know?
Yeah.
And so when I finally kind of let that go and just learn to relax.
Yeah.
And I think the key to this is when we discover, because, you know, like you said, I can relate to, or you said when you're going along, you didn't know you had problems, that you couldn't socialize, you couldn't, you know, your bros and dating and whatnot. I was the same way. I didn't know that I was suffering from something.
Yeah.
I just knew that I felt awkward in a lot of situations.
Yeah.
In hindsight now I understand why.
Yes.
Right? And And that's enlightening to know, okay, wow, that's why I was that way. I feel better about myself now.
Yeah.
And when I learned that, when I got insight and discovered what was ailing me then to the person I am now,
Yeah.
it allowed me to be authentic, right?
Yeah.
And that's what I push a lot in a lot of my groups to people, because they always want to tell me about their stories about why they can't socialize, why they can't do this, why they can't eat this way. It's because they're not allowing themselves to be authentic,
Right?
Because they're based on what other people are telling them to do and how to live, right? It's like that big thumb on us,
Yes.
you know, which is our family, which is society always telling us how we're supposed to be.
Yes.
They're not allowing us to be authentic.
Yeah.
So that's what I push on people.
Yeah.
Just be you.
Exactly.
And it doesn't matter if
Yeah.
you're gonna stumble, fall, or if you're awkward or whatever it is.
Yeah.
Just be you.
Yes.
And and magic happens when they start learning to just be themselves,
Exactly.
and they start being comfortable in their own skin and looking at themselves and see their reflection, and they see something that they like.
Yeah, it's a sense of freedom. I know when I, coming from a dysfunctional family and a dysfunctional environment, meaning neighborhoods where there's a lot of gang banging, drugs, and just all the craziness you see on TV. That was my upbringing. Well, I remember when I first went off to college, but I'm telling you, back then I didn't really realize how effective I was. That is because I've never ever really socialized with any other culture outside of my race until I got to college. So when I got to college, I came back to visit for a break. You know, people were looking at me like I was a sellout because at that time, because the environment, people mentality wasn't healthy. It was, you don't leave and go to college.
Yeah.
You stay here and you get killed and you die and this is just how the story gonna play out. But there was something in me that wanted to fight through all this, although I made a lot of mistakes that they had made, but I got out. And I suffered greatly for that because it was an internal struggle. And even though I put up this hard shell, they never knew that this was a struggle I had. But I've learned that some of the best friends I made was outside of my race, and it was an ongoing process for me. And it took years and years and years and years and years for me to actually get free. Now, when I run across people that has a strong connection to their culture, a lot of times they can't be free and become the person that they need to be because the culture, like the African American culture for me, kept me bound because you have to be this way, you have to be this way, you have to be this way, because this is the pattern that was set. So I was looked at as a rebel because I went to school, got an education, because I started making friends from other cultures and other races. I was started being interested in other women other than African American women and things like that, And so that's why I push so hard. And I run across people, not to disregard of your teachings, but you have to set yourself apart as to if this is what makes me happy, if this is what makes me a better person, then you have to go for it.
Yeah. Yeah, I totally agree with that. And that was definitely a challenge for me. My mother she was hard on me, She was tough. And
that's mine.
But there's a lot of strength there, so I pull from my mother's spirit because she was a strong woman.
Yes.
So I can't discredit that whatsoever, right?
Yeah.
But but along this path, I have been able to kind of free myself and break away almost from change, because there's always frowned upon certain things I did, the foods I chose to eat, the people I decided to date, the music I listened to.
Exactly.
It's kind of out of the box from my culture.
Yeah.
But I have a lot of lived experience from that, and it's kind of made me understand other cultures, and it helps me in my field because I can relate. I'm almost like when in Rome. I can relate to a lot of different people's backgrounds and personalities and whatnot. The people I help at work, people are educated, people with master's degrees, people come in straight out of prison, gangbangers, hooligans, people homeless, 25 years on the streets, pregnant women that are just trying to find some resources. So I can kind of take myself out of my element and kind of relate to them just because I was able to kind of associate and relate to other cultures growing up. So it's definitely helped me along the way.
Yeah. And I do agree. Like your mom, my mom was a single parent. She was definitely, and still is a very, very strong one, probably one of the strongest women I know. And there was a lot of her teaching that I do follow today that was instilled in me. But there was other teachings that she taught us, her kids, that it's not applicable to my life now. Like we were always taught not to trust nobody outside the black race. Well, I mean, how am I going to apply that? How's that going to make me a better person in what I'm doing? I mean, you know what I'm saying? So I had to pick and choose what actually worked for me.
Yes.
And because of that, because of my growth, I'm able to give that back to them, my family, and let them see that, you know, because they see the change, they see I'm a better person. So for them, the curiosity is, wow, look at him, look what he's doing. And so now I can say it's because of this, and that, you know. So, so let's move on a little bit, man. By the way, this is a good discussion.
Yeah, we can go on for hours.
I know, because I'm not even following the questions.
Yeah,
by the way,
it's all right.
So what do a person do after they realize that they have a mental health diagnosis, or if they realize that they have a mental health challenge? What would you suggest a person do next?
I think
or what did you do next?
Well, I'll tell you what I didn't do, and so I kind of did things backwards, because this is what I didn't do, and this is what I'm trying to relay in my groups to people that with a fresh diagnosis or fresh having just an episode, they call it, right?
Yeah.
Being discharged from the hospital. You have to get educated on your medication. Okay, a lot of people get put on meds and then they just want to stop taking them.
Yeah.
Okay?
Wow, that's powerful.
So the recovery model is many pathways. Okay, there's SAMHSA has their version. I have my own version, but this is what I preach in the groups. You're on a medication, and it's to get you what's the word I'm looking for? To get you stable, okay?
Okay.
And so this is what I suggest to folks. This is what I didn't do. You need to stay on your medications, okay?
Yeah.
All right, and establish rapport with your doctor. And you have to realize that your care is driven by you.
That's
right?
exactly right.
Okay, it's patient driven, okay? Not clinically driven.
Yes.
Okay, that's the power of the peer industry that we're in. Right? You need to take care of your own needs. So be aware of the medications you're taking, and if you don't like how they're making you feel, you need to let the doctor know.
Yeah.
Right? Now stay on your meds and get stable, but then start utilizing other things. You know, start eating better. Okay.
Yeah.
Start taking care of your home. Make your bed in the morning. Okay.
Yes.
Start there. All right. Start taking care of your environment, your food, your home, your health. Right.
Yeah.
And things start falling into place. Okay.
Yeah.
Start socializing if you can. Get on social media, even if you're not comfortable going out into the public. You know, socialize with your people. Make a phone call.
Yeah.
Get a pet. Get an animal. Get a plant. Start doing things that are going to make you feel better, because I know along our struggles, there's something that makes us happy, all of us, right?
Yeah.
And you got to try to rethink those thoughts and get back to maybe even your childhood times, things that made you happy.
Yeah.
Right? But I think the most important thing is, if you're prescribed a medication, right? I don't really push meds a lot, right? I've weaned myself off medications. I don't take anything. Maybe I need to be on a mood stabilizer.
Yeah.
I'm not sure.
Yeah.
But if you're prescribed a med, definitely stay on that until you get stable, and then you can further that communication with your physician.
Yeah.
But there's other things you can do, right?
Yeah.
You can meditate. You can do yoga, eat nutritious foods. Those are the things that you need to do, right?
Yeah.
And it's one step at a time. A lot of people think, oh, I'm just gonna go on a diet and it's gonna make me feel better.
Yeah.
It's false.
Yeah.
Oh, I'm prescribed this med, now everything's gonna be great.
Yeah.
It's false.
Yeah.
There's different things you have to do.
Yeah.
Right. And I learned these things. I kind of stumbled into the recovery model mode. So I didn't do those things. So I failed. When I got discharged from the hospital, I didn't follow up with the doctor. I didn't look up the meds I was taking.
Yeah.
I didn't go to groups. Support groups are important. You know, the drop-in centers like the Wellness Recovery Center. Utilize those facilities, right?
Yeah.
You drop in and you just talk to people, or just sit down and hang out.
Yeah.
So go online, you know, just research your mental illness, and there's support groups, there's chat groups, and learn about what it is that you've been diagnosed with, and go from there.
Yeah. So do you feel like your work helps you to stay in recovery as well? The work that you do, you feel like, does it motivate you and empower you to
Absolutely. And I didn't really realize that until my wife mentioned something to me. She told me that ever since you've been working there and doing what you do, it seems like you've been more stable, and you're
awesome.
And you're more in tune of what it is that bothers you or doesn't bother you.
Yeah.
So it's helped me communicate, because I have to live as an example to people, and I run a bipolar support group, an a nutrition support group. I do a yoga group. I do a mental health recovery group.
Wow.
There's 9 groups that I facilitate. And so I have to practice.
Yeah, you're doing a lot, brother.
There's a lot.
Which is good.
Which is good, but it helps me because I have to do research.
Yeah.
And I have to keep whatever I'm talking, I have to keep it fresh, right?
Yes.
And I have to keep it practical, and I have to keep it with the time. So it's helped me, right?
Yeah.
Because when I'm making a connection with people, whether I have 2 people in a group or 13 people, I make a connection with human beings, right? And,
Yes.
and when I see people nod their head and talk to me and we're relating and they're telling me a story and I can relate to that, that's the power in it. So it helps me because I get a better understanding. And I finally realized that I'm not alone in this,
Yeah.
right? And sometimes I can't believe that I'm actually getting paid for what I do.
Yeah.
Because it's just like having conversation with people,
Yeah.
right? Get to know folks and get a better understanding of what's really going on out there. So it's definitely the line of work has helped me become more stable and be more in tune with my emotions and my mental health.
Yeah.
Definitely.
So have you ever taken a rap class?
Actually, I did. I did my own rap. Rap is Wellness Recovery Action Plan. I did my own.
Okay.
So that's helped me too because I learned my triggers when things.
Okay.
I have anger management. I have anger issues. Okay.
Okay.
So I now realize that the first thing that gets to me when whatever it is, someone says something that bothers me, my ears get hot.
Yeah.
And so when I realized that, when I wrote that down, I realized now it's always stays with me. Now I remember. So I call it the toolbox, right? I can pull from that toolbox and I understand when I'm going to start becoming unstable or maybe have an episode, but we don't even want to get to that point, right? Because by then it's too late. But the rap has definitely changed me a lot. And now I'm actually I'm going to go to rap facilitator training here in September.
I was just going to suggest that.
So I can be a rap facilitator.
You would be a very, very good, effective facilitator.
Thank you. Yeah, so I did part 1. I'm doing part 2 in September.
Okay.
So, yep.
Wow. Okay. So do you feel that the best path for recovery is patient-driven? You just kind of talked about that.
Yeah, I definitely do. So because I think you're in charge of your own of your illness. You're in charge of the recovery that you choose to do, right?
Yeah.
And so I think a lot of times when we're in a clinical setting, it's doctors, it's nurses, and they're just telling you what to do. They prescribe you a med, and that's that.
Yeah.
But when it's person-driven, you're an advocate for yourself, right?
Yeah, that's what I was trying to get at.
So we need to advocate for ourselves, right? And that's empowering.
Yeah.
Because when you can advocate for yourself, then people will listen. That's the goal, right? And it's especially in numbers. So if you have a mass of people that are communicating that, hey, I need peer support, right?
Yeah.
Then we're gonna do it, you know.
Yeah.
So I got into this industry at the right time. I never heard of a peer specialist or a peer. I thought that was just a volunteer position, and it used to be. And that's the power of a person-driven support system.
Yeah, I think people need to be taught how to advocate for themselves because we're a lot of us is conditioned that the medical or the clinician field is all be all. What they say is the final thing, and if they say it, it's that way. And we both know that's not true.
Yeah.
I've shared the story on the show a few times. I remember years and years ago, I had went to the doctor for something, and I was explaining to the doctor what was going on in my body, and I told him, and I still laugh at this today, but I was explaining to him what was going on, and he immediately assumed that it was this.
Yeah.
Just immediately. And, I'm like, okay, because sometimes I have to self-talk myself inwardly because because when it comes to me, I'm very, very strong-willed when it comes to me, and I'm a strong advocate myself, so I'm like, okay. I said, well, Jay, just be respectful because he's coming from what he's been trained to do. He's a doctor. And so he was just like, you need to get blood work. It's this, it's that. And I have patients coming here all the time, lying about this, lying about that. So I sat back and I let him finish with his little speech. I said, well, no. I said, I'm not probably the typical patient for you if you're describing that some of your patients come in here and lie about what's going on with them. And I said, I know for a fact it's not this. I knew because I know me. I know the things I did and the things I don't do.
Yeah, absolutely.
And so he was so adamant about it. And I was so angry. I was so angry at him, but I understood why he was so adamant because he's a doctor.
Yeah.
So he said, get your blood work. And he was, and I'm sure this is going to come up in your blood work and blah, blah, blah. I'm like, okay. And even though I told him I was going to do it, in my heart, I wasn't going to do it because I knew he was wrong. So I went home and kind of talked to some friends or whatever. I was like, oh, do it, whatever. And I did it. And of course, I was right because I know what I was doing and what I was not doing. So when I went back to see him, and I could tell he was a little bit ashamed too. But I wasn't rubbing it in his face. And I came in and he said, oh, Mr. Williams, and and so he started laughing. And so he told me what I needed to do or whatever. But and I said, well, doctor, I told him, I said, going forth, I said, you should really listen to some of your patients. Don't base your patients off other patients that lie. I said, because sometimes you might have somebody come here who's actually being honest with you, despite of what your medical profession tells you, And so we kind of got through that and stuff like that. But that really empowered me more and more because for me, I'm not going to go in a doctor and lie about something if I'm really trying to get the help that I need, But at the same time, I'm gonna stand my ground and be the advocate that I need to be to get the best help for myself.
Yeah, and I think that's powerful because you can share the story to me, right? And I can pass this along to somebody else.
Yeah.
Because a lot of doctors, especially in the medical profession like that, it's very clinical, right? And they're in and out. We're in and out, right? We never have a chance to speak. So I think maybe that's a learning experience for him. Yeah. And he'll take another patient's word as, maybe I need to listen a little bit better. Yeah. And I think in the power of advocacy too, there's a voice out there that people can't speak for themselves. Yeah. So I think there's power in speaking for others as well, right? Yeah, exactly. We can be advocates for other people that don't have the wherewithal to speak for themselves. So that's important in overall recovery too. Yeah.
I think the medical field, meaning that the primary care physicians, I think that they are definitely starting to be more open to the mental health field. I went to the doctor with a friend of mine not too long ago, it was a while back, and this is the same friend that kind of suffered from mental health challenges, and so he didn't really know how to. In other words, I helped him advocate because he didn't really know how to articulate some of the things that was going on with him to his doctor. And so as I began to talk and just kind of, explain some of the things that was going on with him, and his doctor was really impressed. First of all, he was impressed that he even allowed someone to come with him to explain these issues that was going on with him. So the doctor opened up and was talking about how he started to get more training in mental health, because he said that a lot of his patients that he started seeing now are starting to come in with mental health challenges, and he wanted to be equipped to be able to help them, in a mental health way and stuff like that. But I think that once again, the education, if you're close with people, if people around you, educate yourself about what's going on with them. Educate yourself about the mental health field, because I think you can help them, but you only can help them to a certain extent.
Absolutely. And I see that too, like you mentioned, people that are dealing with the public, right? Yeah. I'm seeing that in law enforcement now, right? Yes, I have a connection now with law enforcement on, I used to always be in the patrol car going to jail. And now I actually have a really good rapport with some of the sheriff deputies in the neighborhood because they're dealing with this on the street level now. Yeah. Whereas before, people having an episode or a homeless individual or whatnot, under the influence, they just went straight to jail. Yeah, it's not that way anymore. It's more, and that's the power of advocacy, right? Because the stigma's starting to fall off, right? Yeah. So you got medical professionals starting to understand that mental illness it's real, and it's just not going to be helped with being prescribed a medication. There needs to be some support implemented, right? Yeah. And so now I'm seeing it now on the street level with law enforcement, where they actually have like a support team that, like a crisis transport unit or whatnot, that are helping these folks on the streets now.
That's awesome.
And 5 years ago, you wouldn't hear anything like this, Yeah. I kind of scratched my head like, wow, this has changed a lot. Yeah. And I'm seeing it, and we're amongst it now. I just hope it's not a trend. Yeah. And that it continues.
I believe it will, because what happens is, from my experience, is mental health is popping up all over the place. And it's popping up in areas in people's lives that they didn't expect. It's kind of like catching them off guard, you know? Yeah. Whether it's with somebody's mother, father, wife, spouse, kids, cousins, auntie, and it's kind of like they're thrown in this position and kind of forced to deal with it, or I want to say to be forced to acknowledge that mental health is real, because what happens is the way that you or people will normally deal with an issue, you can't normally deal with this particular issue like that. And that's what I've seen from other people that I've known who have mental health challenges, come from good families and you know, different things like that. I have a friend who is Native American, and you know, they have their own tribal beliefs and different things like that. And he was suffering from, or was diagnosed with some mental health challenges, and well, his father did not know how to deal with it. And so culturally, they go to the tribe and sweat lodge, whatever they do there, but that didn't work. So why isn't the way we was taught as actually working? This was the question that he was posing to his son. So when I got involved, I had to kind of explain it to him that, you know, you have to try a different approach. You have to be open to understanding what your son is going through. You may not like it. It may be hard for you, but this isn't about you. This is about your son now.
Yeah. Yep.
You know, and so people are kind of in this position where you cannot deny what's going on, because if you truly love this person, care about this person, you're going to get on board.
Yeah, absolutely. And I see that also with mental health awareness is starting to be more culturally competent, right?
Yes.
I had to go through a training because I deal with so much diversity in the community that I work in. So you culturally have to be able to make a connection, and I think we're going in that direction. Definitely, we're there. You know? We're definitely there. We're definitely more aware. Gender roles and whatnot. You have to have a better understanding of what's really going on, and be able to relate to that person, and not be so clinical or so monotone with it. So it's going in that direction. We're there. We just kind of have to just do a little more work there, you know. But it's definitely, there's a lot more awareness. In this community, anyways.
You talked about gender roles, and it's interesting you brought that up too. I give an example. I like to be transparent. That's why you hear me saying an example. So I know someone back in Illinois, where I'm from. You know, so traditionally, you know, the traditional role in society is set as what? That the man work, bring home the bacon, quote unquote speak, and the woman stay home. She cooks, she cleans, she take care of the kids. Now, you know, in society, that is the traditional role. So now what I see is happening is, a lot of times the man may be the one to stay home and take care of the kids for whatever the reason may be, and the women may be going out there to bring home the bacon, so to speak. Now, for this particular individual in Illinois, that was challenging for him because he's an older gentleman, and this is what he was raised up to be taught. You know, so my conversations to him was, look, you guys are a team. You know, as a matter of fact, the guy in a relationship, the husband, he's like a chef. He's a good cook. The wife can't cook at all. So what are they supposed to do? I mean, if you're following traditional roles, would you just throw her in the kitchen and just burn down a house, so to speak? You know what I'm saying? So you would, in my opinion, you take the gifts and talents that each person have in the marriage, and you make it work.
Absolutely. I look at marriage as a partnership. It's almost like running a business, right? And you got to pull from each other's strengths.
Exactly.
I talked to my sister the other day, and my niece, her daughter's married out of their race, and she was laughing because she was like, you know, we just had a function, and the men are the ones chasing the kids around, and she thought that was awkward because her husband, they were just the ones outside drinking beers and just, you know, being men or whatnot. And she was like, she thought it was odd. I go, well, that's how it is now. It doesn't matter. You know, it's a partnership. And whatever makes that relationship work, you got to play that role. Right?
That's exactly right. I showed one of my close friends' sisters. They gave me a birthday celebration or whatever, and I was showing her I had got a new dining room set, and you know, I showed it to her on my phone. And she was like, nice, and she was like, wow. She was like, you got curtains up, and she's like, you know, cause I'm single or whatever. And she said most single guys, they just have like this big black leather couch and blah, blah, blah. So in her mind, but she's very traditional too, in my opinion. But in her mind, she felt like that, you know, your house is supposed to probably have a smell, big black couch, food, pizza boxes all over the place. No, I mean, despite the fact that my my family dysfunctional. My dad and my mom both are very, very clean people. You know, I like a clean house. I like nice things and blah, 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 etc. But to her, she had this perception of how a guy is supposed to be if he's single.
Yeah.
You know?
And, you know, that helped me when I started to be more authentic, right?
Yeah.
There's a lot of feminine qualities on my part. I can cook. There's some things I can do around the house.
Yeah.
Right?
Yeah.
But I'm okay with it. My
Yeah.
wife's okay with it. I
Yeah.
don't mind it. I don't mind tapping into those feminine qualities, whereas
Yeah.
before, growing up in the Hispanic culture, it was frowned upon.
Right, exactly.
I used to change my baby's diapers
Yeah.
and do that stuff and be hands-on dad.
Yeah.
And it was frowned upon by
Yeah.
some of the other elder men in the house.
Yeah.
And I'm like, why?
Yeah.
And so that played a part in my mental health,
Right.
you know, because I'm like, I just want to be me.
That's
And you
my
guys
point
are
exactly.
you guys are kind of like getting on me because I just want to be a dad.
Yeah.
But and I think that's a part of it all. I think just the way society is, we're just being more ourselves.
Yeah,
right?
you
And-
have to be.
Yeah,
You have to
absolutely.
be.
And yeah.
Now, I will say this. Now, for me, if I ever got married, I like nice things. I can put together a house, curtains. That's just one of my gifts, you know, just interior design. I have it. I can't cook. I mean, I can't cook at all.
Yeah.
I could clean a mess out of the house. So certain things I can do, certain things I can't
Yeah.
do. Now, for me, this just the type of person I am. I think this is my train of thought, the traditional sense of where, for me, I will want to be the one to be the provider in the house. I want to be the one to go out and get a job, bring the money home, because I would want to spoil my wife.
Yeah.
That's just me.
Yeah.
Now, if that wasn't my train of thought, I would feel totally okay with not thinking like that. And at this stage of the game in my life, I wouldn't care about what my culture think or what my
Yeah.
family think
Absolutely.
or things like that.
Yeah.
You know.
Yeah.
And so I've learned through the years to just be myself. Just be myself. As a matter of fact, all my friends is either Russian or Ukrainian. And I don't hang out really with nobody black as far as friends. I have a cousin that little, but outside of that. But I had to, even with that, I had to kind of educate my family on that because they could not understand.
Yeah.
They just, for some, it was hard for them.
My best friends I have one, he's African, no, he's from England, but he's a black man. I don't see him I don't see him ever, but he lives in Florida now.
Yeah.
And my other friend, he's white. He's just a white guy. And,
Yeah.
And it's, those are my two best friends,
Yeah.
right? And we don't see culture, we don't see color. It's just, we get along,
Yeah,
right?
you see
And
people.
I just see people. So
Yeah.
it's, and that's always been important to me. I've always grew up in that's one thing I will credit to my childhood is I grew up very diverse, and I had a multitude of
awesome.
different friends, right?
That's
and I
awesome.
connected with people outside of my race, and that I always held on to that. That's made me authentic.
Yeah. I think that for me, if I would, because a lot of my pain and hurt came from my race. So for me, because if I want to change, to me, it didn't make sense for me to stay in this environment if I want to change or if I wanted to stop being hurt. So it kind of forced me out there in a sense.
Yeah.
Because it never made, even today I think about like, why would somebody stay in a situation if they truly want to change? The pain or whatever, you truly want to change, it's going to eventually motivate you to get out there and take yourself out that situation.
Yeah.
If you really want to change it.
And don't get me wrong, I love my culture. I love our food. I love our music.
Oh yeah.
And I'm very well connected to that.
Yeah.
But sometimes it's okay to venture away and just learn other cultures and traditions and be worldly,
Yeah. So we got 2 minutes. One more question.
Okay.
How do you think we could change the stigma of mental health? What do you think some of the things that we can do as a community to change something?
I think what we're doing right here, we have having an open conversation and talking to people with mental health challenges or have been through it. I think putting that on this type of level, I think that's how we break down that stigma, right?
Yeah.
It has to hit the masses, obviously.
Yeah.
But also on the local level, I feel like it's important for people like me.
Yeah.
I don't have a college degree in psychology or whatnot, right?
Yeah.
But I have a connection with people because I've suffered, right? I've suffered, and the things I did wrong and things I did right, I can share those stories with other people.
Yeah.
So I think that's how you break down the stigma on a small level, local level, community level, and then opening up conversations like you and I are doing, putting on billboards, having famous people talk about it. I think that's how you do it, right?
Yeah.
But we can't forget on the small level, like that what we're, like people like me and you are doing on that level, right?
Yeah.
So
Well, I do think that the personal experience is more effective, in my opinion.
Absolutely.
And I do, and I hope that more men start to come forth too, because we as men, we're taught to be macho. We're taught
Yes.
to internalize our feelings, our
Yes.
emotions, and
Yes.
things. So I think we're going to start seeing more of a movement of the brothers start to come forth and just.
I'm seeing it, man. The people that I talk to on a one-on-one basis, they're coming out the woodworks. They really are. So it's definitely getting there. So we're making some changes.
Okay, well, we've run out of time, and thank you for being a guest on our show.
Thank you so much. I appreciate it.
And that's it for today's edition of Mental Health Matters. If you enjoyed this particular show, or if you would like a DVD copy of the show, or if you would like to be a guest on our show, please dial 916-366-4600. Thank you.